Thank you, Lisa, for that introduction and for letting me be here with you today. You know, red conservative states are under attack these days. And as Lisa mentioned, the problem is actually not in the legislatures. We're actually winning a lot in those fights and getting really good policy done. But I want to talk for just a moment about a new battlefield, one where shadowy organizations on the left are dumping millions of dollars into the fight. They're taking really complicated, expensive, failing ideas like Medicaid expansion to the ballot, using the initiative process to make an in-run around legislatures in states like Utah, Idaho, Oklahoma, Nebraska, Florida, Missouri, just to name a few. And it makes sense why they've adopted that strategy. It's really a compliment because of how FGA and ALEC and principal legislators like all of you have won so much and are winning. You know, we've got the data, we've got the facts, we've got the stories to show what really works and what doesn't. Just like Medicaid expansion might sound good on the surface, but under the hood, it actually destroys the safety net and takes over our state budgets. So through the initiative process, these expansion proponents are peddling huge policy changes that have no implementation plan and no funding mechanisms. You know, they're depending on ignorance really to win the day and then leave legislatures holding the bag to pay the bill. So let me talk for a moment about how does FGA relate to this picture. So we're a 501c3. We have a C4 partner. And as Lisa mentioned, we've done battle in the state houses since our founding in 2011. And we've gotten a chance to partner with many of you to get a lot of historic wins over the past 5 years, more than 300 in fact. And together we've prevented Medicaid expansion in 13 states, including pretty hard fought wins in Kansas and Wyoming earlier this year. Beyond that, we've reduced dependency on welfare. We've made it easier for people to get a job and the next job. And we've pioneered ideas to reduce the cost of healthcare while increasing access to it. I think we could all agree that our goal is we want to have a safety net. We want to protect that safety net. We want to make sure the truly needy are actually being taken care of. But that's under assault by those who don't share our values. You know, 75 million Americans right now are already on Medicaid, yet the left would like to add 55 million more through expansions in the states and through new federal mandates. Medicaid for all. But I don't have to tell you, the state budgets are already being eaten up by Medicaid costs. In many states, 1 out of every $3 in a budget goes toward Medicaid. And if that continues to go up, how much money is going to be left for schools, roads and infrastructure, getting people back to work, public safety, all those things that really matter right now? Or even just to ensure that there's a safety net for the disabled, for the poor who are on Medicaid waiting lists right now, hoping that they're going to get services at some point in the next decade. We had the privilege a couple days ago, our FGA team, to teach a workshop here at the conference about a 10-point plan that we have to help you address state budget issues this year. These are proven ideas from around the states that have come out of past wins. That plan includes a lot of points around Medicaid spending, how to rein it in. So I encourage you, take a look at it. It's an ALEC conference website we put together just for this. Go to thefga or thefga.org/ALEC to see those ideas. And if you're interested in them, just call us or email us. We've gotten lots of feedback already. We'd love to come alongside you and give you everything you need to help us advance that plan. If your state's already expanded Medicaid, don't give up the fight. We have solutions for you too. 80% of our focus is on getting wins in the legislature. And by working with you in the months ahead, we know we can continue to get a lot of those. But we also need to pivot to win on this new battlefield. And at FGA and our sister C4, we're trying to do that right now in 2 ways. First, to do what we do well already with research and facts and giving direct support, but with a twist. We have to reframe it in messages that make sense to ordinary folks around their kitchen table. And then secondly, bringing more partners to the table will give us more strength in numbers. Of course, ALEC, but also groups like AFP, tax groups, grassroots groups, think tanks, they all have a unique strength to contribute to the fight, and we need all of them in order for our voice to be loud enough. We all know that coalitions like that work in the state house. They also work on the campaign trail. Many of you know that 2 weeks ago, Oklahoma passed Medicaid expansion, but it passed by only 1%, or about 6,000 votes. With better tactics and a great coalition that we're working with in Missouri, we think there's a really good chance to have a different outcome 4 weeks from now when expansion goes to the ballot in that state. And if your state is next and a ballot initiative comes to your state with one of these failed big ideas, we want to help you fight it. So again, feel free to check out our plan and our research at thefga.org/ALEC. We'd love to work with you on it. Let us know how we can come alongside you to help you protect the safety net in your state. Thanks very much.